Welcome everyone. At another session after getting the results. So, we have Dr. Deepak, who secured AML 9 and CML 3. First of all, congratulations to Deepak, and he is from Karnataka. He did his MT from JIPMER. And most important thing is he secured such a wonderful rank in the Prime Institute during his first attempt. He just finished his MD just now. Deepak, can you introduce from where are you coming, who all are there in your family, and how did you, where did you did your MBBS and all those details? Can you introduce yourself?
Yes, sir. Hi, I'm Deepak. I did my MBBS in Belgaum Institute of Medical College, Government College in Belgaum. I completed in internship in 2020 February. Then in the November, same year November, I got medicine seat in JIPMER. So I joined on 2021 and I completed my MD in this year January 2024 January 3rd. Uh, and after that, it's my first attempt, sir.
Yeah. Uh, so Deepak, and I just want to ask you how, like, you prepared along with your MD exam because you just finished your exam in Jan. Usually, for AIMS, it is an idea like everyone think that for getting an AIMS or cracking the AIMS exam, you need to prepare much more detail, especially for neurology. Neurology is the most one subject which need a lot amount of plenty amount of knowledge, especially for AIMS because they ask actually questions comes from the DM level questions used to come in the exam papers. So how was your preparation? Like how did you prepare and when did you start serious preparation? But how did you prepare during your 3 years of your MD?
So to be honest, first sem was very difficult here because of COVID and there were no interns, so there was more work, groundwork. So we didn't read anything in the first year. In the second year also, gradually started reading, but not for the exams and all. At that time, we had no idea. Only point was to read for the cases which we were going to see in emergency or in our wards. So in final year, that is when I started reading. Started reading Harrison at that point of time. Then I found and that neurology is what I want to pursue in the future. Then initially, first I started subscribed to Marrow and I was just seeing the videos for the only for the management part. So whenever we used to be in emergency in the night around 2 o'clock, 3 o'clock, if suddenly there is a case, for example, there is a paraplegia, GBS, we were not knowing at that point of time exactly how to diagnose, what are the differential diagnoses. So that at that point of time, we used to see some of the videos or notes and write the diagnosis in our case sheet so that we can present to the consultants next day. So that's how it started. Then gradually, I started liking neurology. So then I started preparing. Actually, started preparing in this March. So till March, I was not sure whether I should write May exam because there were very less seats. So if I want to write or should I go for next November session where there are more seats. So it was all started in till March. I was in not sure whether I want to write the this INA.
So basically, you told that you were seeing cases and learning. That is actually best way to learn neurology or any clinical subject per se, and that sort of knowledge will retain. Unlike sitting and reading, ideally, this is actually the best way to learn. Like to all those students out there, I will suggest you all to read when you are in your residency during the first 3 years. Whenever you see the cases, read those. At that time, you will have more interest in reading, and that retaining things will be much better than you sitting and reading ideally for your exams. For a clinical MD medicine or DM, I will always suggest to read case based, not for any exam based, because your real examiners are the patients. Once you clear the exam, somebody is going to sit in front of you as a patient. That is a real examiner, not your viva, not your entrance, nothing. That your real examiner is always a patient. And you told that you got interested in neurology. So, what made you interested in neurology, and did we as Marrow contribute anything for that?
So basically, I don't like too many interventions. Neurology is more of analytical thing. So you take the history, you do examination, and most of the times we can diagnose by the end of examination without the need of much investigations. So that is what more makes it more intriguing. So that other subjects are more now we become towards the intervention, like cardiology. Most of them now, whatever we are seeing is most of them is going towards intervention part, MG, cardiology. So that's why neurology was more like analytical thing. It's like a patient comes to you, you are sitting in OPD and just only patient and you are there, nothing else is there. But still you can diagnose something without drawing a single drop of blood or to getting an X-ray done. At least you have some idea like what is there. So that is what I like some kind of puzzles which only you are required. Nothing else is required for other than you, at least for the initial part.
Yeah. So for your exam, like for your MD exam and all, did you use Marrow for that also, like for learning cases or something?
Yes, sir.
And did we help in any way in doing those things like case presentations or your preparation for your practical exams or your theory exams?
Yes, sir. Actually, the thing started with case presentations only. So when we come to final year, we usually supposed to present cases twice in a week to the consultants. So at that time, we'll be allotted a case in the just 2 3 hours before the presentation. So in that short amount of time, we used to take cases, and then once we know what is the case, we used to read from the Marrow notes, whatever is available. Printed notes is there in the Marrow app. So we used to go through that before going for the presentations. That's how I started using Marrow for more for both the used to use more mostly for neurology and cardiology because they were the most cases we used to present in the case discussions during the final
Yeah.
year. So that time we used to
You,
see most of this.
yeah, continue.
So that's how it started, sir. So I still remember first I had one myopathy case. First that was my first presentation. Uh, that first my presentation in the final year. So I had not read myopathy at that point of time. So I was still starting to read neurology because there are 126 videos. It's very vast. So I was reading. I was just seeing on SOS basis only. So at that point, I got the case, and my senior was there with me. Like she also helped me in taking the case. Then I went through the some of the general examination in myopathy, like what are the features and what is the myopathy in this patient. So that is how I started using Marrow. Then gradually I started when I understood that I want to take neuro. Then I started making notes for the Marrow in serious way.
So from Mars, you started preparing for seriously for the AIMS exam. Till that, you had confusion, and from Mars, what were your change in preparation? Till that, you were watching some videos, you'll be writing some notes, preparing for the exam. So after March, suddenly, what change you made in your method of study? Anything you definitely made, or you just followed something
No, sir.
you want to
Yes,
do?
initially I used to make notes whenever I had time in the final year. Especially only final year I got some time, especially in my sixth semester. So that time I used to make some notes. But again, uh, in a final exam they may not ask in this depth all these genetics and other investigations. Only exam oriented I used to read. Other parts which were like, for example, congenital myasthenic syndrome, all those tables in Harrison which had very high marks, which I came to know later. At all, I didn't read at that point of time. Only which is required for exam like MND, myasthenia, which are long question, 10 marks question. Only those things I used to read. Then after the exams got over, then in January I thought that there are very less seats. Combining games, PGI and Nimans, there were only 14 seats in this May session. So I thought 14 seats are too less. Like we can't prepare for that. Whether I should go for work or I should take a break and read for 3 months. So I was in the dilemma for the 2 months. So I started working. Anyhow, joined February. I joined the working in private hospitals nearby. So then in February, still I was in doubt, and I used to solve this question bank every day, which how much ever is possible. Only question banks. I already finished watching videos by the time I gave MD exams. So I had already notes for them. Most of the part I had notes. So then in February I started solving MCQs from the Marrow modules. So by the end of the February I finished most of the modules. So then I realized, okay, 2 months are there. Like if I start reading seriously, then I have a chance. I can give a good attempt. And my senior was also telling. She was always telling that if you just take some time before the exam and read for example, 1 month before the exam, take a holiday, long leave and read and try. So that's when I decided that at the March beginning that I have to seriously study. So I studied for the March month. I used to solve all this whatever questions were there, all the GTs, all the small tests for 4-part test used to be there. So I made a list of how many tests are there in which year. For example, from 2020, 21, 22, 23, and I started doing them one by one. And by the end of March, I finished that. So then in April, I decided, okay, I'll take leave for some time. So in April, I took leave, and then I revised the notes again in the April part, and I did the GTs last 2 3 GTs before the exam.
And do you definitely might have a plan for the NEET also, no? Like you are planning, like if you are not getting this name, we'll plan for definitely because you are first timer. And actually, what we see nowadays is actually those who are fresh from your MD, they have the highest chance of cracking. Very easy for them because you will be already fresh. If you have done your MD properly, you have studied properly, you have seen enough cases, things are much easy during the first attempt. Is that what I felt? Because unlike your MBBS level, where if you are writing for MD exam, you don't have any other commitment. You can sit and read. But once you become MD, it's very difficult. You have to run the family, you have to take care of your parents. Maybe your elder ones or younger ones might be there. So it will be a bit difficult for you. So the best part is always to do maximum and learn maximum during the 3 years of residency. So, what is your plan for NEET? Whether if you are not at all qualifying for this, whether you are planning for NEET or you are persisting to get ENA only, next ENA only?
Sir, I thought I'll write NEET anyhow, whatever is possible for NEET. So first I thought, because I had only 2 months, I started seriously in March only. So I thought I'll just read neurology only. So all these 2 months I only read neurology. I didn't read any medicine part because there was no time, and medicine is very vast, so they can ask anything. So I thought I'll just take my chances and I read only neurology. So I thought if I didn't get this time, from next month June, I thought I'll start reading for other subjects also, like cardio, cardio, MG. Slowly start reading for this and prepare for NEET. And other thing is, just before they announced the INI, the news was that they are going to postpone NEET. There will be no NEET this year.
Yeah.
That made me again that I should prepare seriously, because if it is difficult to get in this INI because there are less seats, in next INI there will be more seats, but again because there is no NEET, there will be again too many people competing for the exam again. It will become the same as this INI.
Yeah, actually, for NEET and INA, the pattern is so different. For INA, you need to have more subject knowledge. So actually, what you did was right. Like whatever you like for INA, the medicine part, whatever medicine you studied, your MD might be enough to answer things because
Yes.
the weightage of questions is much less. So if you spend more time for that, is a bad idea. And for next NEET, actually, many will think that next NEET there is it maybe happen next year. So you have a lot of time, but if you think like that, it is wrong because when you have a lot of time you will have tendency to become more lazy, and at the end you may start forgetting things and then you have to study it again from the beginning. So those who cleared just now, it is always better to prepare for the next INI if you are planning for neuro, because neuro is one subject, it is very vast,
Yes, sir.
very very vast, unlike any other subject. And like you are telling, neuro is one subject in medicine which still based on pure clinical.
Yes, sir.
Even though intervention is growing, intervention neurology is growing like anything, they also required management of a stroke. Intervention also required clinical skill. With clinical skill, you can make a right decision. Otherwise, it's difficult. So always that is the beauty of neurology, and that is a bad thing about neurology. When you are away from the subject, you will lose the subject very fast because it's more clinical subject. You see the cases, learn it. That is the best way to learn neurology. And how was like we have Marrow, we have Q banks, we have exams, then test series, we have high yield, and we have subject-based videos. So which one you use? Whether you use medicine videos along with neuro videos or only neuro videos?
No, sir. My neuro, I think in my when I was preparing for PG itself, I had watched around 300 videos of Rakesh sir, medicine.
Oh,
That is what
yeah,
made me take Marrow rather than join the coaching institution, because I was seeing my friend was there in my PSM at that point of time. He showed me that Rakesh sir videos are nice. That is first time I saw his PH videos, how to analysis of PH. So then
yeah,
I saw all his videos. I made all the notes. I didn't. Then when I started preparing for the ISS neurology, then I went through those notes before. Like for example, I'm reading myasthenia. I used to go back to that notes and see what is the myasthenia. Before watching the your videos, I used to go and see those notes, like how my understanding of myasthenia has changed from UG, and after doing MD and seeing some cases, and now reading for ISS, how it is changed. But those notes we can't use completely for INISS, because information is it is little bit less compared to what is given here. So I used to see them, and some tables and some things I used to copy from that notes. But I didn't use only UG notes for that, sir. I thought UG notes. I just saw the UG overview of UG notes, and how I have written multiple sclerosis in that notes, and how it has changed dramatically from that notes to this notes. Now, if I see this, just UG notes is just 2 pages of what I have made notes now, and so many new drugs have come up. So I used to see those notes, and then I used to make see your videos and make notes, and see some tables from Harrison and Bradley, and try to accommodate those tables in my notes, so that at last point of time I just only see the tables. For example, In myasthenia, there is you had told about treatment regarding all these drugs. What are the drugs? What is the dosage, indication, contraindications? So it was very difficult to note on everything. So there was one table in Bradley. So I just copy pasted table in my notes. So whenever I'm reading, I just go through the table. So I know that this table is given like this. What are the concentration? What are the side effects? So same thing I did for all the topics. I used to go and see my UG notes, and then I used to start making notes. So at that point I'll know what is different from UG to preparing for SS. So there was many changes, sir, compared to UG notes.
Actually, yeah, actually, no, not as a matter of faculty. If I'm telling, and frankly speaking, as a clinician, practicing clinician, Marrow is actually I have subscription of Marrow because I'm a faculty here. So I still uses them. I mean, like when I have some doubts or cases, because I have lost half of my medicine. Whatever medicine knowledge I had, I had lost it because I started practicing neurology. So whenever there's some complicated case come, I'll go back to medicine subject or some cardiology topics from Marrow and see that and manage the cases like that. Even I do that. Like we used to face in neurology is like when some patients with some cardiac failure with stroke, or someone with some acidosis, some DKA crossovering, or the neurology part. So those things we have to go to the basic medicine. We cannot send consultation every time. So being a super specialist, so at that time, I still now I'm using Marrow, going back to cardiology, going back to medicine videos, watching those, and then trying to treat my patients. So actually, this is a way of improving knowledge. Even like your like UG Marrow definitely helps you in the MD days. And I had seen many of the DM residents and DNB residents doing DNB neurology, DNB nephro or cardio. They are still using Marrow super specialty app during their DM period. And even I know some of the practicing neurologists and practicing nephrologists still now going through Marrow notes, because these basic things you may miss at the end when you once you start practicing. So this is more than any exam. This is something which is a total knowledge side for me. Uh, then how was high yield? Did you use high yield? Because high yield is basically we have planned high yield basically for NEET, not for INI. But did you watch those videos?
Sir, I finished all the 126 videos. That was I finished before the exam itself. I had finished those, except like autoimmune. There were some videos where you had not discussed the topic, like you have not discussed topic in detail. Like for example, autoimmune encephalitis. You have just taken a video, for example, MCQs, and you discussed depending on the MCQs. So all those things I have not seen previously. So I didn't see them for the exams because they were not going to ask those in the exams for autoimmune encephalitis and leukoencephalopathies. All those MCQ sessions I had not seen at that point of time. So once I decided that I'm going to write this INI seriously, so I saw all the remaining things, and other high yield topics I saw in the last 2 weeks before the exam, just like a revision, like whatever I had read, whether high yield topics, whatever is covered in that all now. Then I made a list of high yield topics that you had made a video in the high yield topics. There was some video, previous videos, some 2 3 years back. So I made the list of all those things, and I made sure that before the exam I just went through those topics. For example, stroke management in stroke, and these tables of myasthenia and tables of dystonia that you have said in that video. So I just made a list of all those things and made sure that at last point of time I'll go through these videos. But unfortunately, from those tables, no questions came this
Yeah.
year. All those four tables. Then other thing is I used to see MCQ NEET SS MCQ discussion also I had seen, sir. Depending on that MCQ only, in between I got very depressed, where you're discussing, I think it is one of the December INI, where the questions were very odd regarding muscle biopsies and too much
Correct.
genetics. You had told that even neurologist also finds it difficult to answer. That made me question everything. Like if they ask questions like this, there's no way I know the answer for them, and it's not possible to find those answers also. Then anyhow, I thought whatever is possible, I just went through those and made them difficult questions, like mark those for the last. At least if I don't know the conceptual answer, I should know the factual answer to get the marks in the exam.
Yeah, actually, those odd questions in between some of the sessions it pop-ups. Some sessions will be totally odd, but even if it is a tough paper, it will be tough for most of the people. Like if they keep on asking DM level question, it will be tough for anyone. So if like in such cases, one thing is a tough question is tough for everyone, so it doesn't have much value. But the thing is, their luck matters a lot. Suppose you have done your thesis, you are done on muscle biopsy, or suppose you did a presentation or your MD days on muscle biopsy, you might have read all the new articles and everything, so you will be able to answer that. So such times, like such questions comes, luck also has lot of importance in this type of pattern. Like pattern of INA is almost actually reasonably good. INA usually don't have that much fluctuations, but for me the pattern keeps like fluctuating like anything. Sometimes they will ask very high for questions, keeping angiogram, keeping DSA picture, and asking what is a vessel. But another time they will ask directly from Harrison. So this pattern you cannot predict. That is a major problem, major drawback actually, because they are taking questions, might be they might be taking questions from all over the country. So each person may provide their own favorite areas, their own interest. So they will be expertise in that. So some question will come like that. So that can be expected. Nothing can be done. So those who are watching, don't get like don't feel bad for such questions. Like those questions are tough for anyone. You cannot do anything for that. But then another question is, like, you had watched Ragesha's videos, you had watched many of the videos of neurology. So out of the all, which all videos in medicine, which all videos in neuro you feel it is actually good? Like you found interest in those areas?
Uh, so UG, when I was preparing for PG, I watched Rakesh sir videos. All videos were like enlightening for me because I didn't read that much for the when I was reading for the final year exam in MBBS. So all those things were new for me. Now since in JIPMER we see many cases, like most of the exam cases we usually will be seeing in all these GBS, quadriparesis, and myelopathies, myeloneuropathies. We usually see so when I'm reading also, I'll correlate that I had seen that case, this finding was there. So it just enhances whatever I was reading. Uh, Other thing is one thing which completely different from seeing cases and reading is what I found is stroke, sir. Because we usually only thrombolyze here, but most of the time patients come usually out of window period, so that chance will also be taken away from them. So I didn't know exactly like what is the protocol for stroke and all. So once I am free, I was in peripheral posting. I started watching stroke because there are 10 videos like for only for
Yeah.
pathophysiology, then clinical features. It was very big videos, but still, once I started watching, then I really gradually understood that there is so much happened in stroke that I have no idea about. Like for example, this thrombolysis agents. What are the contraindication for thrombolysis, and then thrombectomy? When do we do thrombectomy? All this non diffuse. Usually, we here thrombectomy is not done, so we have no idea about what is going to happen. Only thing is thrombolysis, and some cases we see thrombolysis with bleeding. How do we manage that? Most of the time, we manage what we as seniors are telling us. We actually don't go and see what is given in Harrison or what is given in the guidelines. So once I came to final year, I started reading for this AHA guidelines regarding stroke, ICH, and ischemic stroke, and only I understood that so many things are there. So one video that changed is stroke for me, sir. And other thing is myopathies, because myopathy so much is genetics is involved, and we usually see myopathy from broader perspective, like how to differentiate myopathy from myasthenia, how to differentiate myopathy from or exam, how to differentiate in between different myopathies. I had no idea at that point of time. So when I saw these videos, I understood. Like for example, there are some signs where family history is important. For example, a polyhill sign, either in LGMDs, diamond on quadriceps. All these signs are there which we can identify, and for example, we can tell this is there without genetics. So these two things is what changed me.
Yeah, and stroke is one field which is evolving. You will understand that when you once you are joined, because we did DM during the time when the stroke is evolving. Like the thrombolysis is happening during our time. Like we started in 2017. At that time, thrombolysis was started building up. Thrombolysis setup was started building up, and we finished. I finished my 1 year SRship after completing DM in 2020. At that time, thrombectomy was booming in Kerala. So those thrombectomy was also new to me when I started practicing. I learned those in 2020, 21, 22 maybe, because this is keep on changing. The field is now very much advanced. So, how? What is your future plans? Like, what is your preference for if you are going like you're going whether you're basically from Karnataka, so you are planning to join AIMS, or what is your plan? Whether it enhanced AIMS? This confusion always happens because I studied in Karnataka. That confusion always comes when you are from Karnataka.
I am still in dilemma, sir, whether I should choose Nimans or I should go for PGI or AIMS. I'm not sure what to choose for now. I have to ask my seniors and like, have to decide it, sir.
Anyway, you have enough rank to get any of this, and you should ask opinion from your seniors, and how is the practicality in your situation, where you want to practice and how you want to build your career. All those things depends. So uh, all the best, and all the best for the future, and hope we shall keep in contact again, and message me once you get into your you decide on your course, which course you want to continue with.
Yes, sir.
So all the
Thank you,
best,
sir.
and I'm very happy to talk with you, and I hope that you might be feeling overwhelmed because of this result, because as soon after passing your MD, getting such a great rank is really awesome. Congratulations once again,
Thank you, sir.
and thank you so much.
Thank you, sir. Thanks.